Welcome back, everyone. We are excited on the Two Sleuth podcast because I think this may be some 70 some episodes in that we have our first guest on that is all about AI. Everybody's hearing about AI. There's tons of companies out there, but I'm super honored because my guest today, Rahul Sharma, is the CEO and founder of Neurality Health AI. He's a successful, let's see if we can say that 3 times. He is a successful health tech entrepreneur with multiple exits and has raised many rounds of capital, having gone through prestigious venture accelerators like Y Combinator. Most recent exit was for a SaaS services solution called Reviving Mind, where he built an EHR and multi-state telehealth clinic to address chronic illness. The company had an M&A in winter of 2023, so not too long ago, which is good because it freed him up to do this. Prior to building and exiting technology startups, Rahul worked as a lead software engineer at LinkedIn and Yelp. He holds a BSEE from Cal Poly and was in the MSCS PhD program at Northeastern University, researching artificial intelligence, information retrieval, before he dropped out. You're a dropout. Dropped out to start his first company in the staffing software industry called Jobletics. Rahul, my friend, welcome to the Two Sleuth podcast.
Pleasure to be here, Greg. Thanks for having me.
That's a lot to read, man. You're like a super smart guy, aren't you?
I think maybe on paper more than anything else, but yeah.
Come on now. We've had some conversations with introductions I've made, and you're a pretty smart guy. I could tell. Yeah.
Thank you.
You're welcome. Yeah. So I want to hear a little bit more about, so from your perspective, right? We hear everything about AI, especially now in dental, and I know you're newer in dental, so it doesn't even have to be in dental. There's so much conversation about AI. I make the joke, and I'll launch off with this. I always make the joke like with ChatGPT, right? For those of us that are neophytes, right, that use ChatGPT and like that's like our AI, right? Understanding. I know more than that, but I always say I always start with please and end with thank you with ChatGPT because when they take over, I want a good job as our human underlings. So tell me a little bit about, from your understanding, the acceleration of AI and how it's been integrated into our world, and really where some of the foundings are from, because you're well researched about where it really was before it became like the buzzwords of AI in common vernacular for people like myself.
Yeah, great question. So, I think really when Chat GPT kind of came onto the market and really got kind of popularized, say, really a year and a half to 2 years ago. Not to get too into the weeds here, but we're at GPT 4.5, right? 4.0 just came out, right? So they're saying GPT 5 is supposed to come out sometime early next year. So the rate at which things are progressing is just mind blowing. It absolutely is, right? In terms of kind of what kind of AI and language models of yesteryear used to be able to do, and how functional they are relative to that, it's in orders of magnitude better. What you're seeing now is systems that can truly have human-like conversation, which is, for what it's worth, what we're working on over at Neurality Health AI, but moreover, the ability to actually do meaningful work and actions, right? That can be taking place and make a material improvement in overall operations and overall business and things like this. There's AI is kind of a broad term. There's so many applications to it. Obviously the field of robotics is advancing very rapidly, and that's, to me, kind of the next frontier, if you will, with the combination of kind of this more formidable kind of AI that we're seeing nowadays.
Well, and you mentioned robotics, and I think of like implant dentistry and robotics, and you look at, Yomi, and you look at, some of the others like a Naviguide and that are assisting in implant placement. I go back to, not my first exposure, but, as you were talking, I was thinking of the carbon printers, like the printers for the labs. And the coolest thing that they did for their marketing, right, to talk about what they can do, is they would print a shoe, right, a pair of shoes on their carbon printers and be like, oh, look at this, here's a pair of shoes for you. And I just thought it was the coolest thing ever, right? And because then the application into, okay, so what can it do for your in dental, right, for a dental lab, because it was specific for dental labs before they made versions that could be used in office. And so for AI, tell me a little bit about what some of the applications, because we see with some of the companies like Overjet and Pearl and those, where it's, look, you can use this to detect caries and to have color pictures, and now it's all of these shapes where, because looking at, a grayscale for a patient and saying, oh, see how it's a little bit darker right there, you should get that taken care of, and we can take care of that, it's a cavity, right, a carie, you know to where now it's like it pops on the screen, and here's the conversion rate of doing more dentistry, and here's the percentage of increases, right? That general dentistry side, not my lane, full well that I'm in the full arch lane. But talk to me a little bit about what you're doing at Neurality Health and how the application of AI in dental operations from the point of view of what you all are doing.
Yeah, great question. I think to date, like the Overjets that have done phenomenally well, and the Pearls and whatnot, you know, from a computer vision perspective and reading X-rays and giving kind of insights around those, um, that that problem, in my view, is one that has pre-existed, and it's moreover deeply clinical, right? I think with the advancement that we've seen in AI and really large language models across the last couple of years, there's a real opportunity now to materially improve the operations side, really, namely the front office or and even the back office to a certain extent, right? And the way to think about it is, from a patient experience perspective, um, it's hard for me to really get in touch with somebody and get questions answered. Simple questions as to, I've got a root canal, or I've got a chipped tooth or something to that effect that's urgent. What does that really mean for me? How urgent is it? How quickly do I need to get into the clinic? Yeah, it hurts, but what does that ultimately mean? Um, and from a patient engagement and experience perspective, I want to be able to call somebody, namely a practice, ideally somebody pick up the phone, which unfortunately a lot of front offices are heavily burdened with a lot of other things that front office staff is having to do. And it's first of all very hard for me to actually get in touch with somebody. And if I do, and I am lucky enough to get in touch with somebody, being able to meaningfully get the kind of information I need to be able to schedule the appropriate appointment, understand kind of what the cost implications are for me, who are the actual doctors, dentists that I'm going to be that are available that I can see, right, and what is the most optimal sort of approach or plan for me. Uh, that unfortunately that information is not readily available to me as a patient. So my experience in turn is always sort of kind of last minute. It's always diagnostic. It's not proactive. I'm not getting the kind of education I need as a patient, right? And again, with the advancements that have happened now, AI is able to take a large amount of very narrowed information about the practice, the service lines, the doctors, the insurance, etc. Very quickly understand and learn about that specific practice, and meaningfully in a very conversational format, very human-like conversational format, communicate those things to me. Ultimately, de-risk me, the patient, around what I need and when I need it, and what my cost implications are going to be. Right.
Yeah, and I like the examples that you gave. I'm going to bring it over into my world if I can for a second. I think of, a patient who has a situation with an implant, like, oh, my implant fell out. Well, maybe what really happened is like a cover screw came off or a healing abutment came loose or something like that. But for them, for the patient and their patient experience, right? If they just paid, two, three, $5,000, whatever it is for an implant, a single implant, and they feel like, their feelings, right? Their perception is reality, that their implant fell out. There is this sense of urgency that they have, and they want a human interaction. And you said something so poignant there, and it was just kind of like a throwaway line, is that if they do get somebody live, it's probably somebody working at the front desk, and the level of clinical knowledge that that person would have, more than likely, and I'm making a huge generalization, they're probably going to have to put the person on hold and find somebody in the back that can answer that question. And probably not just anyone in the back, but somebody who probably participates in the implant dentistry part of the practice. Of course, huge generalizations. So having this interaction with AI, right, that is so critically important, because everybody's trying to figure this piece out, right? And I'm not even talking about outside of normal business hours, right? The 24/7 answer, right? Because everybody's trying to figure that out with outsourcing and overseas, telephone like integration pieces and human beings over there. And what you're telling me is what you've been working on. And, I may know a little bit about this, so I might be setting you up for this question, is that the engagement with conversational AI for these types of situations to be able to allay the concerns of the patient itself, B, be able to give them some really good information that they can, you know, it, it'd be great if they could give that emotional response, right? Because I talk about emotional responses, emotional engagement in those situations, right? So tell me how patients are currently engaging with conversational AI. How close are we getting to where this can actually be happening on a regular basis, and at what level, right? So it from what I would say when I'm talking about a level like just the simplest of concerns for a patient, all the way up to what I describe, which I think would be something a little more advanced.
Yeah, great question. I think we're very close to getting to kind of how you would qualify what a advanced scenario would be, right? I think the kind of the more call it non-trivial problems that I think are really getting solved by solutions like ours and kind of other solutions is that really kind of the human response, human-like response mechanism itself, right? So if it's voice AI, which is a mode of communication that we provide, right, inbound voice, where you can call in to a practice, and our voice AI will pick up, and if you're a pre-existing patient, it will be able to pull information from the system and say, "Hey, Greg, great to hear back from you. How can I help?" And by the way, it will have short-term memory, midterm memory, and at scale, long-term memory. It'll remember who you are. It'll remember different
Better
things.
than most humans, probably.
Well, undeniably, undeniably, right? Undeniably. I think there's only so much kind of cognitive space or that we mental space rather that we really hold, especially in a busy practice where you're able to truly personalize and remember things and make the person feel like they're being heard, right? Ultimately. And so I think when it comes to more kind of um, things like empathy and remembering things and making the patient feel like that it's really personalized communication and that it remembers. I think that problem is to a certain extent um, almost solved, right? I think as it pertains to more complex questions, things that are a little bit more workflow specific, things that are a little bit more sort of unique to the practice, to the service line, etc. Those are just things that the AI needs to ultimately learn. Upon the AI learning these things, its ability to meaningfully communicate back to the patient what they need to know will be something that it should be able to do. So, from a Neurality Health AI perspective, we do inbound voice, right? So we are able, the voice AI is able to pick up the phone, and unlike kind of legacy solutions that are like IVRs, right, where press 1 for X, press 2 for this, but
So
and you go
annoying.
through, yeah, and you go through this unending loop of nothingness, or just an answering machine, or maybe just a dead line, right? Our AI actually picks up. It'll remember you if you're a new patient. It'll intake you. It'll answer your questions. It'll schedule you for your appointments, and I'll do all these things, right? And I think something that's a little bit more nuanced but very important is this notion of proactive engagement, right? Again, us as consumers of healthcare broadly, right? And of course, speaking more specifically about dental, we're really only thinking about kind of our oral health when something's going wrong. Most of us, I would say 99% of us, are really thinking about our oral health as an afterthought, right? We're not really thinking about it in terms of, what are the implications that my oral health has with my micro gut biome, right? Or my cognitive health, which there are clear clinical studies that suggest that there's deep ties between the two, etc. And so a entity, in this case AI, that's proactively engaging me and asking me how I'm doing, kind of more from a patient kind of success standpoint, that's heavily welcomed, right? Not selling me, not marketing to me, hey, your next appointment is in 3 months and come back in and we got 50% off. Yeah, sure. Some of those things can play a role in getting people back in. But what's going to really motivate me is a provider and a group and an entity that's actually reaching out to me and trying to understand who I am, how what I'm about, and how do I think about my oral health, and educating me. Fear is a very big thing in dental and healthcare broadly, but definitely in dental, right? People are very scared about getting things done in their mouth, right? And so a lot of that fear can be and should be alleviated by that proactive engagement and education.
Yeah, and what you talk about there is a big value add. So I'm curious because what's coming up for me as we're having this dialogue, and I'm sure for many of my listeners, is if it's pulling from like an existing patient that you share, if it's pulling information from the patient chart, let's just call it the patient chart, it really then becomes even more critically important for notes to be accurate because like on my side, right, one of the most important things is we teach the handoff hand up at GNA Consult, which is from each touch point of the patient journey, from initial inquiry to the consultation when the patient shows up, to taking of the records, handing off to the treatment coordinator, the doctor engagement, all of those pieces, the little pieces of information that are picked up along the way so the patient doesn't have to repeat themselves. Because in full arch, it's a home run or a strikeout, right? There's not this building of lifetime value of a patient, hygiene, and then different treatments that happen along the way. So the critical aspects of that is getting the information into the patient's chart, right? And so that piece of, well, that's Jenny. She always comes in with the most beautiful handbags that you can possibly imagine, and they're homemade from one of their neighbors. So I would think that there, and I'm going to be a little tough on you, there tends to be something that's lost when there is an AI engagement, at least over the phone. But so there's a little cost benefit analysis of what's being lost, but a tremendous amount that's being gained. So would you agree with that? And how would you comment on that for those that think in the way that I've just kind of, in my mind, adding things up from both sides of the ledger rather than just throwing softballs at you and trying to say, oh, look, he's got the greatest thing ever. Everybody should be doing it.
Yeah. No, very fair point, Greg. And, even as an innovator in the space, I try to come with a healthy skepticism, right? How, again, ultimately the end-to-end user, right? Yes, we're improving operations, the cost for the practice and the owner operators and management, et cetera, and streamlining things. But at the end of the day, who's really benefiting from this ultimately is the patient, right? Because they're getting what they need, when they need it, and their overall health is improving as a result of this, right? Um, I too came into this and was skeptical, even with, and you've heard our voice AI, right? I ask folks to go check it out. It is very human like. It truly is, right? And kind of very similar to the discussion we're having, and it is about as close to that as you can get. I too was skeptical, in terms of how actual humans would interact and what will be lost, if anything, right? Um, what I've found and what we have found internally in being in production for the for a few months here is that quite the opposite, right? People are actually engaging with this AI in ways that I would have never imagined in a million years. So much so that they are confiding in the AI. They are telling it things that I don't know that they would otherwise tell a human. Likely why? Because they don't feel judged. They know that it's there to give them what they need. They know that it's listening, and we've programmed and we've built the AI under those characteristics and that persona, right? It's really, our AI is really built under the persona. I come from a more therapy and coaching background is kind of what my last company did. And there's a lot of kind of nuanced things that come from coaching, motivational interviewing and things like this, these concepts that really allow for the experience in coaching and in therapy to be to have really great outcomes from a mental health perspective. We've used a lot of those same kind of techniques in training this AI, where you're listening, right? You're doing consultative communications and motivational interviewing with these patients. You're not judging, right? And so what we're finding again is that people are actually confiding in this AI. This is it's a this one particular case I can share with you is we have a practice that beta tested this and launched our solution a few months back, and a customer. This was a little bit before Memorial Day, and one of their patients had to cancel an appointment. Called in, AI picked up, and told the AI that, hey, I have to cancel. I'm going with my family to so and so place, and I'm going to have to cancel. And the AI basically responded and said, "Great." Actually, gave the patient some ideas for where to take their family, around town and things like this. And he was like, "Yeah, I'll give it a shot." But when it came time for the follow up appointment, he actually called back in, and he urgently called back in, and he said, "Listen, I have a chipped tooth. I'm in a lot of pain. I'm so embarrassed. Remember that Memorial Day event I told you about? I got super drunk. My family was there. I fell. I chipped my tooth. Got into a bit of a fight with one of my relatives. Yada yada yada. Long story short, it went down this whole kind of path of what happened, the scenario, and everything that happened during that event. And ultimately, the AI said, empathized and said, "Oh my goodness, I'm so sorry." Obviously I'm paraphrasing. This is not the exact
Sure.
transcript,
Yeah.
but I'm so sorry this happened. These things happen. Hopefully everything's okay. Don't worry. You're in good hands. We'll take care of you. I'm going to prioritize your chipped tooth. We'll get you taken care of. Got the guy scheduled. And I can't even make this up. If I wanted to, the guy literally said at the end of the call, "Thank you so much. I love you," period. Right? So you're right. Had you asked me quite a few months back before we deployed this thing, kind of the skepticism you shared, I would have said the same thing. Yeah, you're probably going to lose some things, and you're probably going to, people are just going to kind of treat it in a certain way and things like this. I would have said the same thing. But what we're actually seeing in production is remarkable. People are confiding. People are actually telling it things that they may not necessarily feel comfortable telling a human, and as much as we, want to have that human experience, and I think that we don't want to eliminate that by any means, right? We're just trying to bring a solution to market that allows the actual employees, front desk workers, administrators, etc., to do higher value work. That's kind of ultimately what we're looking to do with this. Um, it's the fact that the AI doesn't is not going to judge you, right? It's not going to bring its own biases to the conversation. It's not going to bring these things to the actual engagement. So I think there are likely things that are being that you miss from the human experience too. But I think there's a lot of things that can be gained from engaging with an artificial agent also. So.
And it sounds like with the accelerated learning that the future is, I mean, very exciting to be able to see what more unfolds with increased engagement in this level. And I love to hear that. That's very exciting for sure. All right, Rahul, this is the part of the program. All of my guests play a little something called What the Sleuth is Going On? It's 3 rapid fire questions. First thing that comes to mind. Are you ready to play?
Let's play.
All right. Question number 1. What's the worst bad breath you've ever encountered?
I mean, I don't know if it was this, but I suspect it was gingivitis. I want to say it was gingivitis, and it was, I'm not going to out them, but it was an older family member. And God bless her. Well, I told you the gender, so yeah, God bless her as an aunt. Well, you know, not the.
You are narrowing the scope. You went from I'm not gonna, as a older family member to a her to an aunt. I mean, if anyone that you know in your family is listening to this or knows your family, I think they're going to be able to narrow it down, Rahul. I think you're going to be in some trouble.
The good news is it's a big family, so they'll have to really dig.
Mine too. So all right. So you might have a thin veil to hide behind. So I got your back. All right. Question number 2. If you could go back, if you could change one thing about your smile, what would it be?
You know, I don't know if I should give a big grin here or not, but I had the equivalent of Invisalign when I was younger. So I don't wear anything like that anymore, but I do feel like my 2 front teeth stick out a little bit. I wouldn't really qualify them as buck teeth just yet, but they stick out a tad, yeah.
Yeah, so I did that as well, but in my adult years, and I do still wear a retainer, like a night device. It's a sleep device, like a sleep a dental product for to pull my lower jaw forward, and it's amazing for snoring. But when I was a kid, my 2 front teeth didn't come in together. One came in before the other, and what I've noticed over the course of years is the one that came in first, it's starting to drift down again. And I'm like, am I going to have to go through another revision? Even though I wear this dental appliance like at night, and it's supposed to serve as both anyway. So that's my cross to bear. So there you go. All right, question number 3. If you could go back and be the inventor of any dental product, and no, you cannot choose your own, which one would you choose and why?
Any pre-existing dental product? It has to be an actual?
Yes.
I mean, probably Invisalign, to be honest with you. I mean, the fact that, you know, you don't have, I wore braces as well.
Braces too.
I wore braces as well as a child, and not the fondest memories of that, right? I think something.
You had the wires and the brackets and
right,
all that.
Something invisible that progressively gets your teeth in line. I suspect that's an answer you probably received from a lot of people you've interviewed, but
I may or may not have gotten that once or twice before. Yeah, but I think it's, you know, I mean, something that helps aesthetically, and it also helps too for people to be able to reach tough to reach spots and be able to floss more easily, and help them to have a better oral health, which in terms of the overall health, like you talked about, the body, the mind, all of it. And I appreciated you bringing that up earlier. So absolutely. Well, I want to respect your time and my listening audience's time, because some people are like running on a treadmill or outside, and I don't want them to pass out or fall down and hurt themselves. So in the last few minutes, is there anything I haven't asked you that you want to share with my listening audience today, Rahul?
No, I think it's been a great conversation. I really appreciate the time and the great questions. I think you know, it's an exciting time, very exciting time. You know, as it pertains to AI in dental and all of the advancements that are happening. I think there's a real opportunity to you know, ultimately help a lot of practices, help a lot of patients, and get them the care they need with some of these advancements. And if you're a practice owner listening and want to optimize your operations and improve your patient engagement, then I'll shamelessly plug again Neurality Health at the end of this call or this interview. But please do reach out to us. Go on neuralityhealth.ai and check us out, and can reach me directly as well at Rahul at Neurality Health AI as well, and happy to chat with you.
Yeah, perfect. And we'll make sure that gets into the show notes. My guest today on the Two Sleuth podcast has been Rahul Sharma, the CEO and founder of Neurality Health AI. Thank you so much for being a guest on the show today.